A major transition for the Department of Health and Human Services. Good evening, I'm Jennifer Griswold. It's changing the contractor it will use to oversee its foster care and family support division. But this story has many layers to it. Ruta Olsenida peels back and finds out more about the new contractor and what's causing controversy with this bid.
The Nebraska Department of Health and Human Services is making a big change as to who oversees foster care and child welfare management in Douglas and Sarpy counties. Promise Ship, based out of Nebraska, has held that title for the past 10 years.
So there's an enormous amount of progress that has happened both here in the Eastern Service area and throughout the state of Nebraska, and I think we can all be proud of those.
Gave both Promise Ship and St. Francis.
But after the 10 years, a new contractor, St. Francis Ministries, based out of Kansas, proposed a bid. That bid was chosen over Promise Ships.
We were very surprised to see the difference in the two cost proposals, given the fact that we've been doing this for 10 years and we have a pretty good idea of what it costs.
Promise Ship offered to do the job for $341 million over the course of 5 years. Meanwhile, St. Francis Ministries offered to do it for $197 million, a 60% difference. The proposed budget is much smaller. Promise Ship doesn't know how St. Francis will do the work efficiently under these circumstances.
The only way you make this happen and the only way you don't run a huge deficit is that you're going to have to reduce services to kids and families.
But St. Francis is confident that even with the smaller budget, they will excel in their services.
I wasn't involved in the selection process. We put forward a bid, and that bid was accepted. And our work going forward is to do everything to meet the requirements that are in that contract that we signed, and to fulfill any of the state statutory requirements that are contained in that.
My fear is nobody could do a good job with that kind of budget.
Heather Duhajek Chase works in human services and has concerns about St. Francis's bid. She fears salaries will be cut for workers, they'll be overwhelmed and overworked, and children will not have the resources they so desperately need.
I haven't heard anybody that I know of, and I know a lot of people in the human services field, that have felt like they could do it on this budget.
Caseworkers will be under the same guidelines as in previous contracts, Promise Ship and even those prior, as well as state employees, of that 12 to 17 caseload. So that criteria doesn't change.
And just recently, our news partners at the Omaha World Herald reported that after St. Francis's initial bid, they asked for $15 million more to comply with Nebraska's caseload limits. The state denied that. St. Francis says this was hypothetical.
There were questions around if we were to have to change up a model. What would that look like? And that was what our estimate of adding additional people, if we were to change a model, would look like.
Then comes into question St. Francis's previous work in Kansas. There are allegations of children sleeping on office floors and not getting enough resources.
The Nebraska delivery of service is much different than the Kansas delivery of service, so you cannot compare the two.
So the state of Kansas during the Brownback years went through a very significant period of cost reduction. And unfortunately, those costs cut across all of the different agencies. DCF was one.
They assure their work here will be up to standards and people will be satisfied with the results.
So our work will be around keeping kids safe and meeting those performance measures.
Reporting in Omaha, Ruta Olsenida, 3 News Now.
Promise Ship claims that St. Francis's proposal does not meet standards. They are now legally challenging the state's decision to award the contract to St. Francis. We'll make sure to keep you updated as this story develops.